Halito. In this week's Choctaw Nation of Oklahoma COVID-19 update, I want to answer some frequently asked questions we're receiving from our associates, tribal members, and guests. I'll also have a special guest joining me today, Chief Medical Officer Dr. Jason Hill, to discuss some medical questions about this global pandemic. I encourage you to please leave your questions in the comments section of Facebook. We're collecting questions from social media and associates. Each week, we'll try to provide answers to your most common questions. For this week, I'll go through some of those most common questions that I have received. For example, how long will the Choctaw Nation be closed? Well, our goal is to return to full operations. And so one of the things we have to do in that, there's three critical areas. First of all, the safety and health of our tribal members, the safety and health of our employees. Secondly, is to make sure that we meet the needs of our tribal members. And lastly, we want to make sure that the tribe remains financially stable. By balancing these, if we can come to a stable, we will return to full operations as quickly as possible. The next question is, how long will I get paid and receive benefits? Well, currently we've already passed where every employee receives full pay and benefits. And I want to give a huge shout out, a yakoki, and thank you to all of our employees that are currently working, our medical providers, our people in our travel plazas, the people in our country markets. They're doing an awesome job helping our economy keep going and meet the needs of our tribal members and our communities at large. So again, our goal is to make sure that we provide those benefits from now on and continue that as long as possible. Will I be laid off or furloughed? Again, our goal is to return to full operations. So right now we're wanting to make sure that everybody continues getting that full pay and benefit. Our goal is to assist this every 2 weeks of balancing those three things again, of making sure that we deal with this pandemic, we make sure that our employees and our tribal members are safe, and making sure that we are financially stable. So that's, again, we're going to try to reduce that time so that there is no layoffs at all. Do I have to keep coming into work? Of course, we're practicing our CDC guidelines of social distancing. We're wanting to make sure that everybody stays safe. And so one of the ways that we're doing this is those people that are at work, is that if they do have to come to work, they are practicing those social distancing guidelines. They're making sure to wash their hands effectively. But also at the same time, we're making sure that those people that do not have to come to work, that they are able to stay home, make sure that they can work from home best that they can. And so that's our goal, is to make sure that we're trying to reduce this pandemic so that it doesn't continue to grow and spread. What if my job can't be done from home and I don't want to come to work due to fear of contracting the virus? Again, I want to say a big yakoki thank you to those people that are braving, that they're living out the Choctaw Strong and making sure and going to work and providing those services to our tribal members and to our citizens as a whole. But again, we're wanting to make sure that you do need to come to work, because it is critical that you help support our economy, that you help support our people. And again, we want to make sure and practice those CDC guidelines so that our employees' safety and health is of utmost concern to us. We want to practice those good behaviors. Our tribal services continuing uninterrupted. Yes, they have changed just a little bit, but yes, they are being delivered. So for example, like our elders, we are still delivering the meals on Wednesday. However, we're delivering those as drive-through. We're making sure that everybody can access services through social media and also through our phones, or of course through email. So we want to make sure if you have any concerns or whatever, you can reach out to us at 1-800-522-6170 or at choctawnation.com for any services that we currently have. Are our stores still open? Yes, our stores are still open. We're still making sure that our Choctaw country markets are open, because again, it's vital that we provide food services to our people so that they can have those. And again, we're practicing CDC, social distancing, proper cleaning, and all those techniques, as well as at our travel plazas. We're doing the same thing and making sure that we provide fuel for people that need it. There is necessities that they need to provide. And again, we're practicing those CDC guidelines of social distancing and good behavior. What if I can't pay my rent or mortgage payment on time? Within the Choctaw Nation, we've been very blessed. And what I mean by that is if you have a lease to purchase home, a LEAP home, if you have affordable rental, or if you have an independent elderly, we have suspended those payments so you do not have to make a payment for the month of April. Also, if you have received rental assistance, such as the Section 8 program, we have extended that you have the ability to be on that program for another 60 days. So again, we're just excited that we're able to offer that to our tribal members. Well, I'm very honored to have Dr. Jason Hill here with us today. He's our Chief Medical Officer with the Choctaw Nation Health Services Authority. He's been with Choctaw Nation for 18 years, and like I said, I'm excited because he is my actual doctor when I go to the hospital in Tallahassee. And so one of the things we're trying to do today is a lot of people have been asking questions in regards to the coronavirus and what's going on with that, and how are we prepared medically. And so I just thought it'd be best for Dr. Hill to be able to answer those questions. So glad to have him here today. And so one of the questions that everybody seems to ask is, Dr. Hill, is how do I know if I have the coronavirus?
Well, the only way to know for sure would be to have a positive test. But the symptoms of coronavirus are very similar to the flu. So you might just feel extremely fatigued and have some muscle aches. You may notice that you have a cough or you're short of breath. Some people even have things like abdominal pain or diarrhea. But the most telling symptom right now is fatigue.
Okay. Well, and so a lot of those are just like the flu type symptoms, like I said.
Right.
It's just a little bit more complicated. One of the other things that people are asking is, what are extreme or life-threatening symptoms?
Well, any of those symptoms that I've mentioned before, if they get more and more severe, particularly shortness of breath, if you find that you're very winded with even the slightest bit of exertion more than normal, that you can't stop coughing, anything that seems like you have a significant worsening of symptoms would be possibly life-threatening symptoms.
And so anytime that you have this feeling of, man, this is more than just the I'm trying to think, allergy symptoms that we have here in Oklahoma. So if it gets worse than that, where you just have trouble breathing, those is when you need to have it checked out.
Absolutely.
The next question, should I be tested for coronavirus, or why wasn't I tested when I visited one of the Choctaw Nation medical facilities?
Well, there is a limited number of coronavirus tests available anywhere in the state of Oklahoma. And because of that, we can't test every single person. So what we do is we have developed a ranking system to rank those with the most severe symptoms and make sure that they have the availability of the test first.
And so we do have the test at our health facilities, is that correct?
Yes, we do.
Okay. So everybody wants to know what happens once I arrive at a Choctaw Nation Health Services facility. How do I get screened? How do I get triaged to see if I'm basically infected?
Well, the first thing you'll notice when you come to one of our clinics or hospital that things have changed. Because of the infectious nature of this particular disease, we'll stop you at the door, and what we're trying to do is to screen you outside of our facilities to make sure that you don't transmit anything to the other patients or the employees there in the clinic, and also that if we accidentally have a sick employee that we haven't identified yet, that we don't infect you if you're not sick. So what we're doing is we're screening at the door. If you come in and you have a cough and a fever, we're going to ask you about that, and then we're going to put a mask on you, and that way to help reduce your chances of spreading that disease to someone else.
Okay. So also, I've heard about a malaria drug or other possible treatments for coronavirus. Will Choctaw Nation be offering any of these treatments for COVID-19 patients?
So let's go ahead and talk about the malaria drug that you mentioned first. As you probably have all heard, President Trump mentioned the malaria drug hydroxychloroquine, which goes by the old brand name of Plaquenil, and we've had that on formulary for many years now. We use it mostly in our population for the treatment of rheumatoid arthritis and also for some folks with lupus. And it can also be used for missionaries traveling to countries that may be endemic to have malaria, and we've had those available. It turns out that there are some very small studies that say that this may help in the treatment of this new disease, coronavirus. The trials are very small. very limited number of patients. We have ongoing tests the government's running to see if exactly what dose is the right dose and if it actually works more than a sugar pill would, more than placebo. So we do have those drugs available. Because we don't know if they actually work or not, we're trying to save those as a last ditch effort if we had to, but we also want to make sure we don't deplete those supplies for the people that have the need for rheumatoid arthritis or lupus.
Well, Dr. Hill, I think for me, a lot of times what I hear you talk about, whether it's the triaging when people come to one of our facilities or in regards to medicine, is it right for me to assume that you're trying to make sure and keep those items available for the sickest of the sick? Is that a good assumption?
Absolutely.
Okay, and then as far as protective equipment for our employees to make sure that they're safe and they're meeting all the guidelines, do we have all the proper medical equipment?
Yes, we have a good supply of the N95 masks that have the charcoal filter that filter out the virus. We also have plenty of face shields and gowns for our healthcare workers as well as the patients when they come into the facilities.
Well, Dr. Hill, just thank you so much for being here. Hopefully I won't see you again until my annual physical is due. And I want to just thank you all for joining us here today and say Yako Ki, and keep those questions coming in, because what we're trying to do and what I'm trying to accomplish is to answer your questions as best we can do. The thing right now is openness, and communication will get us through this. I want to remind everybody, be Choctaw strong. Let's stay strong together. Let's stay united. We can beat this pandemic. Thank you, and God bless you.